How do October scan artifacts impact eye diagnosis? Imagine trying to read a map with smudges or blurriness. That's similar to what happens when October scan artifacts appear during eye examinations. Optical coherence tomography is a powerful imaging tool that gives detailed cross-sectional pictures of the retina, helping doctors diagnose conditions like glaucoma and age-related macular degeneration. But sometimes, these images aren't perfect. Artifacts are errors or distortions that can sneak into the images, and they can really influence how accurately a disease is diagnosed or monitored. These artifacts are surprisingly common. Studies show that only about 1 in 10 October images are completely free of errors, even when the scan quality seems acceptable. Some typical artifacts include shadowing, which can hide important parts of the retina, especially in the macula or optic nerve head. Shadowing often occurs when there are media opacities like cataracts or vitreous floaters blocking the light. Eye movement during the scan can cause blurring or duplication of images, making it harder to interpret the true structure of the retina. Defocus or blinking during the scan can also create artifacts, leading to unclear images. Segmentation errors are another common issue, where the software incorrectly identifies the boundaries of retinal layers, especially in eyes with unusual anatomy or high myopia. These artifacts can have serious effects on diagnosis. For example, if shadowing hides a lesion in the macula, a doctor might miss early signs of age-related macular degeneration. Conversely, artifacts might mimic disease features, leading to a false positive diagnosis. In glaucoma, precise measurements of the retinal nerve fiber layer are essential. Artifacts that distort these measurements can cause a doctor to think the nerve fibers are thinning when they are not, or miss real thinning altogether. This can result in unnecessary treatments or missed opportunities to start therapy early. Certain populations pose additional challenges. Patients with high myopia often have elongated or irregular eyes, which can cause segmentation errors or distortions in October images. Ocular conditions like cataracts or vitreous opacities can also increase the likelihood of artifacts, reducing the clarity of the images and making interpretation more difficult. That's why clinicians need to be especially cautious when reviewing October scans from these patients, sometimes supplementing with other imaging methods or clinical exams. To minimize errors, eye doctors are trained to critically evaluate each October image for artifacts before making a diagnosis. They compare findings with clinical examinations and other tests to confirm or question what the images show. Recognizing artifacts takes experience, but advances in technology are helping. Newer October devices and artificial intelligence algorithms are being developed to detect and correct artifacts automatically, improving accuracy in the future. In conclusion, October scan artifacts are a common part of eye imaging that can significantly impact diagnosis and treatment decisions. Being aware of these artifacts and carefully assessing images ensures that patients receive the most accurate diagnosis possible. Always remember, if you have concerns about your eye health, consult a qualified eye care professional who can interpret your scans in context and provide personalized advice.